We are probably Charleston's biggest independent GI practice here across the Charleston Low Country area.
Dr. Richard Schatz, the newest member of the Charleston GI team, says their recent expansion into the Carnes Crossroads area gives them the ability to help even more patients. And today, Dr. Schatz wants to chat about one issue he sees quite often throughout his day. It's called Irritable Bowel Syndrome, or IBS.
IBS is a very common gastrointestinal diagnosis. In fact, it can affect as many as some say up 10 to 15% of the American population, which is a obviously very large number. Over 35 million Americans, healthcare expenditures reaching over $35 billion, annually.
It's a high price to pay, especially for those living with the disorder, as many can go years without a proper diagnosis.
It's important for us as gastrointestinal providers to kind of understand the patient's symptoms, understand their background, understand their medical history, and then kind of use that interplay to kind of arrive at a correct diagnosis.
Schatz says finding the root of the problem isn't always easy.
We do see patients that are commonly diagnosed as having IBS, or they dismissed with their abdominal complaints, that it can actually mask other gastrointestinal diagnoses, such as celiac disease, such as inflammatory bowel disease, such as small bowel bacterial overgrowth, other kind of inflammatory conditions, even in the colon, other infections, things like that. So before somebody simply gets labeled as having irritable bowel syndrome and we go down a road of treating simply that disorder, it's important for us to kind of recognize what symptoms these patients have. Do they have any alarm features? What is their clinical history? And that'll help dictate kind of the best evaluation, both from a lab standpoint, an examination standpoint, potential endoscopic standpoint, where we take a look either in the colon or the upper digestive tract in order to arrive at the correct diagnosis.
As far as symptoms of IBS, there are quite a few, he says, many of which can also come with other common gastrointestinal issues.
Abdominal pain, bloating, urgency, those are the constipation, diarrhea. Does it get better when you pass a bowel movement? These are some of the common presenting complaints. Now, can there be others? Yes, but these are the ones we see most often.
Dr. Schatz says no matter what the diagnosis, it's imperative that both the patient and the physician work together, because for some, this can be quite a journey.
It's very helpful that we have 12 gastrointestinal doctors. We also have physician's assistants as well that work with our practice. And so we pride ourselves on being available to both patients, to primary care providers, and to be able to provide a service to their community.
And this state-of-the-art facility is only the beginning, as Charleston GI will soon have even more to offer patients across the Low Country.
You can see our number. We're here 5 days a week, and available after hours as well if need be. And we want to just do what we can to help patients.
For more information on services, locations, and more, visit charlestongi.com.